Hello dear doctors, welcome to 𝗖𝗵𝗵𝗺. I am very glad that now we are entering into the world of liver, into the world of hepatobiliary system and pancreas infections. Now in this video we will discuss about, first of all, the introduction to all the topics which we will be discussing in the hepatobiliary pancreatic system, and then we will be moving towards the most important of HBP system, that is going to be hepatitis. I'm sure you must have heard somebody in your relatives, in your known, suffering from hepatitis every now and then. Coming on to the introduction part, in hepatobiliary pancreatic system, which I call it as HBP system, we will be discussing the hepatitis in this video itself. Next will be yellow fever in the second class, and in the end we will be discussing the amoebic liver abscess, the echinococcus, the trematoda, and in trematodes we will discuss the fasciola and clonorchis. My dear friends, this is the perfect time to start with our first class, that is hepatitis. Now hepatitis is very common these days. Whenever the word hepatitis comes, people often relate hepatitis to sexually transmitted disease, but that's not the truth. Let us discuss and clear all our concepts about hepatitis. First of all, I want you to look at this question. This is a previous year question which was asked in one competitive exam, that viral hepatitis, my dear friends, is responsible for producing the Councilman bodies. Now what does this mean? So please remember that viral hepatitis causes an eosinophilic globule. Eosinophilic globule will be there, that means a red color of globule which will be there, which is surrounded by normal parenchyma, and that is called as Councilman bodies, which is seen on liver biopsy. So a red color eosinophilic globule which is surrounded by normal parenchyma, okay, which is surrounded by normal parenchyma, it is called as Councilman bodies, seen on the liver biopsy. So what is this? This is a hepatocyte. Okay, this is a hepatocyte, my dear friends. Okay, so hepatocytes having the round globule surrounded by the normal parenchyma. Let us now understand about the general hepatitis virus. Okay, so hepatitis does not have a single family. Just like a new bride who is, who does not belong to only one family, belongs to two families, right? So similarly, my hepatitis does not belong to one family, it belongs to a different family. So basically, hepatitis is a group of viruses. Hepatitis, that means producing inflammation to liver. Though they belong to different families, but are grouped together in one roof called as hepatitis. Why? Because every one of them is responsible for causing inflammation to liver. So if you remember my general virology notes, I told you that yes, herpes, hepatitis, then pox, then adeno, papova, parvo, all these were DNA viruses. Okay, all these were DNA viruses, but I told you it is not hepatitis, it is hepatitis B, which is a DNA virus. So see, hepatitis B is a DNA virus, rest all the hepatitis are RNA viruses. Rest all the hepatitis are which viruses? Are RNA viruses. Now let us now understand the names of the families. So remember that hepatitis A is having the name, the family picornaviridae. Hepatitis B has hepatitis by its same name, that is Hepadnavirus. C belongs to 𝗵𝗵𝗴𝗺. Okay, this is the same where yellow fever belongs to, where dengue belongs to. Okay, so 𝗵𝗵𝗴𝗺. After that you have got 𝗛𝗲𝗴𝗺, and then you have got 𝗏𝐶𝗵𝗴𝗺 and hepevirus. Okay, or hepevirus. So how will you remember? Remember, private hospitals favor rich clients. So basically this is not only delta virus, this is called as RNA defective delta virus. Okay. So P for private, H for hospital, F for favor, then rich RNA defective delta viruses, clients is 𝗏𝗏𝗃. Okay. Now how these are going to spread? So remember that hepatitis A and hepatitis E are going to go together. Hepatitis A and E are going to have fecal-oral route. Remember 𝗏𝗏𝗃 coming together. So A and E are going to have fecal-oral route, whereas hepatitis B, C, D, all of them are having parenteral spread. Okay, they are not coming from orally, they are coming from parenteral routes. Okay, that means not orally, else oral they can come. And hepatitis B, B for blood, so easy to remember that it is spread by the blood also. But please remember B and D. So if you write like this, B and D look similar. Similarly, hepatitis D needs hepatitis B virus for the survival. So this was that introductory table. Coming on to one by one individual viruses, hepatitis A. So hepatitis A spreads by fecal-oral route, and hepatitis A at least requires 2 to 6 weeks. Okay, because 2 to 6 weeks is the incubation period for hepatitis A. So it is going to have 3 phases. One is going to be the prodromal phase, because it is hepatitis, obviously inflammation, so the fever etc. symptoms are going to come, myalgia, weakness, everything. Then comes to icteric phase, when there will be yellowish discoloration that will be seen, and in the end it is going to get resolved. So it is called as which phase? The phase of resolution is called as recovery phase. This is called as which phase? Recovery phase. What are the complications? Complication is fulminant, but it is rarely fulminant. Okay, it is very rarely fulminant. Okay, then how will you diagnose? You have to check for IgM antibodies, ELISA and RT-PCR you can do. And remember, yes, the vaccine is available, killed vaccine, live attenuated vaccine, everything is available for this. Okay, so just one thing which needs a trick to remember is this one, that 2 to 6 weeks is the incubation period for hepatitis A. Okay, you got it? Great. How to remember? So remember, in a match of cricket, you will be given a A grade, that means a good grade, when you hit 6s, right? So 6 weeks is the incubation period. So from match of cricket, you can remember them. Coming on to hepatitis B virus, please remember, hepatitis B virus is a partially double-stranded DNA. I told you that P is like this, and if you put one more circle, it becomes B. So P for partial, and what does this B stands for? B for hepatitis B. Remember, this hepatitis B is an enveloped virus. Hepatitis B is an enveloped virus. Just go through general virology, you will understand what all this means. Size, you can say that it is 42 Dane particles. So remember how to remember. See, hepatitis B, and B is the which alphabet? It is the second alphabet. And if you multiply it by 2, it becomes 4. So 42 nanometer is the size. Very simple. Hepatitis B, B is the second alphabet. If you multiply by 2, it becomes 4. So 42 nanometer. Not nanometer actually, 42 Dane particle. So Dane particle is the measurement unit. Okay. Coming to antigens. So hepatitis B has got different antigens. Okay. So if I just make a diagram, so see the diagram carefully. What it is going to have? It is going to have inside this material, this is called as virome. And after this virome, you can see it is going to have some antigens like this, the flower shaped one. This is what? This is called as the surface antigen. This is the surface antigen. So my dear friends, surface antigen starting from S, so HBsAg, that is the surface antigen. It was previously called as Australia antigen, if you can remember, remember it, and it is encoded by S gene. It is encoded by what? It is encoded by S gene. Coming on to next one, that is called as C. C gene is responsible for hepatitis C antigen, that is called as core antigen. So it is found in the core, and then you have got hepatitis E, that is encoding for envelope, that is coded by pre-core gene. So this is coded by C gene. Okay, so it is easy for you to remember. Remember, it has got S antigen, that is surface antigen, Australia antigen, then C antigen, that is a core antigen coded by C gene. Then you have got E antigen, that is envelope antigen coded by pre-core gene. How it is going to get spread, I told you, by the parenteral route most commonly, but it is spread by sexual route also. It is spread by vertical transmission as well. What do you mean by vertical? Vertical means mother to fetus. And yes, with the contaminated needle sharing, it is also going to spread. So it is spreading by the sexual route, it is by the parenteral route, it is by the vertical route, and by the needles also. So a relatively simple way to remember is, just like I told you, B and P look similar. So P for 1 is parenteral, then P for penetration, so sexual route is there, then P for puncture, puncture means needle sharing, and P for, you can remember, placenta. So placenta not directly, but yeah, it can give you a clue that from mother to baby it is going to go. Okay. Now what is the incubation period for hepatitis B? So if I write the letter B, I can get these two circles. So one circle will be like this, other circle will be like this. So that means 6 and 6 weeks to 6 months is the incubation period for hepatitis B. How will you diagnose it? Obviously by ELISA and PCR. And remember one important thing, the complications of hepatitis B. But before I tell you the complications, let us look at the, see, I told you it is 42 nanometers Dane particle. This is for the complete virion. So hepatitis B also exists in the form of an incomplete virion, which for which the size is approximately 22 nanometer. Okay, for which the size is approximately 22, not nanometer, 22 Dane particle, you can call it as. Okay, so now I can come to the complications. So if I talk you about the complications, yes, it can also show the chronicity, cirrhosis, and even the hepatocellular carcinoma. But these complications are not commonly seen with hepatitis B. These are most commonly seen with hepatitis C. So we will talk about the complications there, and vaccine also I will discuss later on. Hepatitis B is not ended here. Okay, let us discuss some other things about hepatitis B before. So see here, now there are two things. One is the antigen and other is the antibody. Okay, so remember that there is an antigen called as hepatitis B S antigen. Okay, so similarly there will be an antibody called as hepatitis B S antibody. Okay, similarly there will be hepatitis B core antigen, but because it is inside the hepatitis virus, there is no antibody corresponding to the core. I hope you are getting it, that there is nothing like anti-HBc. No, there is no anti-HBc. Yes, of course, there is hepatitis B E antigen and there is an antibody against it, hepatitis B E antibody. Now, what does this indicate? Remember, if you are having HBs antigen inside the body, it suggests that the infection is present. Okay, and if there is anti-HBs which is present, that means the immunity has developed post-infection or even the post-vaccination. Okay, so post-infection or the post-vaccination, the immunity has been developed, but somehow the immunity is there. HBc antigen is not seen in human body, in the serum. Anti-HBc IgM and anti-HBc IgG. So anti-HBc, C stands for chronicity. That means if it is chronic or acute. So anti-HBc, if there are IgM present, that means the infection is acute. Whereas if IgG is present, that means it is chronic, or you can say it is a past infection. HBe antigen tells you that the virus is highly infective. Okay, the virus is highly infective, and anti-HBe if are developed, that means infectivity is comparatively low. That means infectivity is comparatively low. So let us decode these things. For example, you are having HBs antigen positive. This is suggestive of infection. And for example, you are having another thing, that is anti-HBc IgM positive. That means it is an acute infection. So I hope the things are clear. Similarly, for chronic infection, so in order to see if there is infection or not, we should have HBs antigen positive. But if in order to have it chronic, anti-HBc IgG should be present. Okay. Then next thing which we can discuss is recovered infection. So recovered infection whenever is coming, anti-HBs should be positive, but because you are talking of recovery, then anti-HBc IgG should be present. Okay, so recovery and then your chronic infection are almost similar. After that, you have got vaccination. So if you want to know about the vaccination, anti-HBs should only be present. There should be no HBs antigen positive. There should be no anti-HBs antigen positive, no HBs antigen, because this is suggestive of infection, whereas there is no infection in vaccination. So anti-HBs should only be present. Okay. What do you mean by window period? So if anti-HBc IgM is present only, that is suggestive of window period. Okay. So this is suggestive of window period. Okay. Now recovery phase, I think I have told you that if yes, this one chronic infection or the recovery phase is going on, we can say like that. Okay. And yes, now for example, one more example if I take, you have to tell me in the comment section, if HBs antigen is positive plus anti-HBc IgG is there plus HBe, or I should say anti-HBe is positive. Yes. Now tell me the status. Okay. Tell me the status. Okay. You got it? Great. So this was about the serological markers of hepatitis B. Okay. So dear friends, coming on to the vaccine, yes, absolutely. There is a recombinant vaccine which is present there, which is given at an interval of 0-1-6 months if the patient is suffering from hepatitis. Okay, 0-1-6 months. This is the dose you have to give. Also, it is very important. I think we have discussed the lab diagnosis before. How will you treat it? So remember, the treatment of hepatitis B is actually the interferons which we give, and the drug is tenofovir also. Okay, the main drug is actually lamivudine, which we give. So this becomes a question also, because lamivudine is a drug which is given for HIV also and hepatitis B also. Okay, so this is the drug which is given. So this was about the hepatitis B. Coming on to hepatitis C now. So hepatitis C is very similar to hepatitis B in terms of transmission. So I don't have anything to tell in that. The laboratory diagnosis is ELISA, RT-PCR. This is how you are going to have. Yes, the chronicity, the cirrhosis and the hepatocellular carcinoma. Okay, I'll write it. Hepatocellular carcinoma. This belongs to hepatitis C only. So these complications starting from C are belonging to hepatitis C. Now what are the extra hepatic manifestations? Remember, lichen planus, this is a skin disease which is associated with hepatitis C. Then you have got MPGN. What is MPGN? Membranoproliferative glomerulonephritis. So this is associated with hepatitis C. That is why the mnemonic is MLC. So M for MPGN, L for lichen and C for hepatitis C. So these are the extra hepatic manifestations. And what is that treatment? Please remember 𝗵𝗵𝗵𝗺. Okay. So there was an exam. So one of my friend whose name is Veer, he was passed by the lady examiner. So 𝗵𝗵𝗵𝗺, and the other thing which you can remember is 𝗵𝗵𝗵𝗺. Okay, this is another drug which you should know, 𝗵𝗵𝗵𝗺. So this was about the hepatitis C infections. One more important thing is that hepatitis C, please understand, this is the one which is also called as transfusion hepatitis, because it is the most common hepatitis which occurs via transfusion. So it is also called as transfusion hepatitis, and hepatitis C has an incubation period of 2 to 6 weeks. So now it marks the end of hepatitis C. Coming on to hepatitis D. D and B love each other. That means D requires B for survival and multiplication. So some of the boys and girls who are sitting in front of me, they are joining their names like D loves B. Huh? So hepatitis D and hepatitis B love each other. They mostly they need each other for the survival and multiplication. So obviously the transmission is going to be parenteral, just like hepatitis B. Now please remember, if there is hepatitis B virus plus hepatitis D virus, they are coming together. This is called as co-infection. But if there was a chronic hepatitis B running from very long time and now hepatitis D virus is coming, this is called as super infection. So for example, if you have IgM hepatitis B, yes, IgM hepatitis B S antibody, then and IgM hepatitis D antibody, then both of them are existing as a co-infection. Whereas if you have HBsAg antibody, that means it was a chronic hepatitis B infection, plus IgM hepatitis D antibody, that means it is a super infection now which has come. Obviously, you will need ELISA and PCR for the diagnosis, but the treatment is treat hepatitis B and hepatitis D will resolve automatically. Coming on to the last but not the least, hepatitis E, fecal-orally being spread, and please remember 2 to 9 weeks is the incubation. So NE, E is important because E has hepatitis E. Remember, it is known to cause the complication of fulminant hepatitis failure in pregnancy, okay, which is actually responsible for 25% of mortality, female mortality or mortality in the pregnancy. Laboratory diagnosis is very similar, the RT-PCR and the ELISA, and the treatment in nutshell is going to be what? The treatment in nutshell is going to be treat the hepatitis A and it is going to get treated. Okay. So this was all about hepatitis. I hope that you liked this video. Thank you so much for watching. We'll see you in the next session.